In Tanzania, where the country has confirmed its first ever cases of Marburg. Marburg is a highly fatal viral hemorrhagic fever and has symptoms broadly similar to those of Ebola. The health ministry has confirmed the deaths of 5 people out of 8 infections in Tanzania's northwest Kagera region. The 8 developed symptoms which include fever, vomiting, bleeding and renal failure. Among the dead was a health worker. The 3 who survived have been getting treatment, with 161 contacts being monitored.
It
has been 5 days since this disease was first reported. A total of 8 people have been confirmed to be infected, and 5 of these people have lost their lives. The remaining 3 are still receiving treatment at the health centers in Kagera region. On behalf of the government, I am sending my condolences to anyone who has lost a family member, a friend or community member due to this disease.
For the latest on this situation in Tanzania, he is CGTN's Daniel Kijo in the country's capital, Dar es Salaam. Daniel, what more can you tell us about Tanzania's first ever cases of Marburg?
Thank you so much for having me. And indeed, it is something that baffled the Tanzanian government since the first time it was announced last week. We know that the Tanzania National Public Health Laboratory analyzed the samples and indeed confirmed that it is MVD, which, as you said, is a very rare but severe fever. In fact, it's in the same class as Ebola. 8 people, like you said, have been confirmed, with 5 people losing their lives. 3 people are now in care at health centers in Kagera. We know that the patient 0, or the first patient, is the one who contaminated the family. So it's a family of like 5 people who first reported this case. And of course, one of the people who lost their lives is a health worker. We know that there are about 161 contacts that have been identified and are being monitored right now. And of course, as you know, Marburg is a disease that started in Germany in 1967 and expanded to many parts of Africa and the world. So indeed, it was something that has shocked Tanzania, and the health ministry is on top of it.
Right, so this is a first for the country. How are health authorities responding to this outbreak?
Well, the authorities have sent a health team to Kagera. The WHO is working with the Ministry of Education, and they've deployed an emergency team to Kagera to carry out other epidemiological, research and tests to ensure they find out, exactly how far the disease has spread, who else might be contaminated, etc. And they are, situated in all the focus areas around the family where this is started, at the health center and other parts. And they're looking to identify as many contacts as possible who have come in contact with affected patients over the last 1 week. As you know, the disease is extremely volatile, and the government wants to make sure, and the WHO wants to make sure that they contain it. So as far as it stands, they have sent the teams and are working hard. And the WHO says the fatality rate is about 88%, and that there is no real cure. You just have to treat the symptoms as they come. So it is a serious case, and both the WHO and the Tanzanian Health Ministry are working hard to ensure they contain the situation.
Right, and given that the Marburg virus is highly contagious, like you said, are there concerns that this disease could spread to neighboring countries?
With a disease of this nature, and after the last few years with COVID-19, etc., the Tanzanian government has really upped its game in terms of monitoring and controlling infectious disease. In fact, the regional World Health Organization regional director for Africa congratulated the government on how it handled this Marburg case, as she's also, the WHO is also very closely working with the government. But as it stands, the health minister Ummy Mwalimu says that there is no need to fear that the disease will expand beyond the Kagera region. The health ministry says it is being contained, and indeed all those contacts that came in touch with the affected persons are being monitored. So they seem to feel as if it is in control and it won't affect any other neighboring countries. But of course, it is still being monitored, and we'll keep updating as the teams report to the public and the government.
Oh, I thank you for that update, Daniel Kijo, live for us in Dar es Salaam, Tanzania. So let's discuss this further. We have Dr. Mohamed Munira, a virologist at Lancaster University, joins us live now via Zoom. Dr. Munira, what do you make of this first Marburg outbreak in Tanzania and in East Africa?
Well, I think the important point here is that in a relatively shorter period of time, the virus has been reported in many countries within Africa who do not really share the borders. And that is really the indication that the disease is emerging, because if it can spread from Cameroon to Equatorial Guinea and Ghana to Tanzania, it can spread beyond these countries. And when these viruses, particularly the ones those that are having high contagiousness, these are the ones that are going to pose really a big challenge. And not only this, I mean, the Marburg virus is not new. I mean, we knew about this one in 1967. That was the time when it was first identified. But since 2004, the virus has been appearing into different countries at a higher level. That is really projecting the disease is having a very high level of propositions that will spread beyond countries where it has been reported at the moment.
So what do health authorities need to do to contain the spread of this disease or of these cases?
Yeah. Since we don't have a vaccine or approved drug against Marburg virus, I think the only option left really at this stage is to aggressively do the surveillance to identify where the virus is hiding. So identifying where it is there, providing the opportunity that we will be able to stop the transmission from those people into the nearby communities, but also getting back into the animals. And one of the things that I really wanted to highlight is that these filoviruses, where Marburg and Ebola belong, they can go under dormancy, so they can infect a person and can stay there for several months without really having a clinical sign. So aggressive surveillance is really the key to identify where those are hiding, because until we don't find where these viruses are hiding, it's very difficult to contain them.
Why are we witnessing outbreaks of Marburg in Africa now? What could be the source?
Well, this is a very broad and very important question, is that as the time passes, our interaction with the animals are increasing day by day. And every time we get closer to the animals, we have more chances to attract those infections. Those are actually prevalent in the animals. I mean, in the animals, we have around 1.67 million viruses that are circulating into the animals. And out of those, 75% are the ones that have a potential to cause infection in human. And Marburg, particularly, since we already know that it can infect the fruit bats, any person that is getting closer to the fruit bats in caves, in mines, without having precautionary measures, they are the one who are going to catch that infection. When they bring that back, that's going to spread into the community.